American Lung Association recently released its State of Tobacco Control report. It grades each state based on 5 categories, including tobacco prevention funding, smoke-free air laws, access to services to help smokers quit, state tobacco costs, and sales of flavored tobacco products. Now, out of all the 3 states in our region, Pennsylvania actually did the worst. It received failing grades in all 5 of those categories. So tobacco use, of course, as we know, affects us whether we are the smoker or if we're just around it. And experts say tobacco increases risk for those with COVID-19. So it's more important than ever to cut back. So joining us now is Dr. Andrew Martin from Deborah Heart and Lung Center. Good morning, Dr. Martin. Appreciate you being here.
Good morning.
All right, so obviously a very important topic here. Tell us how tobacco use increases the risk for COVID-19. It's very timely now with what we're dealing with.
Well, we're not sure exactly how. We know it does increase the risk for severe disease, probably due to the fact that it maintains sort of a state of inflammation in smokers' lungs, and really just, again, increases the risk for severe disease, need for ICU stay, and mortality.
All right, and obviously it's not good that we're kind of failing in all these categories here, but people tend to think e-cigarettes is another option to cigarettes and vaping perhaps a healthier alternative to smoking actual cigarettes, but this isn't true, is it?
Well, e-cigarettes on the whole don't appear to be as harmful as tobacco itself, but they are not harmless. There are several, we had, before COVID, we were very worried about vaping-induced lung injury. So as an alternative, probably not as dangerous, but it still keeps you a smoker.
Yeah. Still keeps you dependent, for sure. That's what you're trying to avoid. So smokers, they may think that they're too far gone into the habit. Quitting won't impact their health much, but you say that your body will start to heal right away. Tell us a little bit more. The minute you quit, your body starts to heal. Is that not right?
Almost immediately. What happens with the lungs, at least, is almost immediately, whatever damage might have been done due to smoking, such as emphysema, at least stops getting worse. So if you stop smoking, it doesn't matter how old you are, or how long you've been smoking, you're going to be better off 5 years from now than if you kept smoking.
Right. And quitting, of course, depending on how long you have smoked, may seem impossible, a daunting task for smokers, but it can be done. So what are the first steps people should take if they want to truly quit?
Well, I tell my patients it's kind of like having surgery. First, you have to make a decision that you're going to stop. Then I tell them, if somebody says you need your gallbladder out, you don't just go home and hope it'll happen. You ask when. You schedule a date, and then at that time, the plan is really just on that date, you don't have cigarettes anymore.
Right.
Also, it's something that you have to realize you're going to suffer a little bit when you stop smoking. There will be some cravings and some withdrawal symptoms, and just like any other procedure, you want to prepare for that. How are you going to deal with it? There are things to decrease those things, such as varenicline or Chantix, nicotine replacement, bupropion or Zyban, can all decrease the withdrawal symptoms. But the first step is deciding you're not going to die smoking.
Right. You got to make that decision and that commitment. Okay, so what can we do, getting back to the vaping issue, what can we do, because sometimes obviously we have seen a lot of these stories and reports that children are the ones being targeted by these vaping companies. So what can we do if our children, we think that they might be vaping or they might want to start? How can we get that message across to them?
Oh, how do you deal with children and teenagers that want to smoke? That's a little beyond my expertise, but I think the best thing is education, to make sure they understand that those things have risks.
Right.
I also try to communicate that there's going to be examples presented to you of people who smoked their whole lives and never had a problem. Just like when any other drug use. And sure. I think making them understand that doesn't mean there's no risk, and that it is harmful. As far as controlling teenagers' behavior, I'm going to leave that to someone else.
Sure. But at least creating and maintaining that open dialogue, for sure.
And making it realistic.
Right, exactly. Okay, Dr. Martin, where can people go for more information? Because obviously this is so very important and something that we all need to improve on in this area, for sure.
Exactly, yeah.
Where can we go for more information for this?
Well, the American Lung Association has a vast resources for patients. So I think that's one of the best places to go to get advice about smoking cessation. If there's any state-run websites, quit lines are also good places to go. But again, I want to stress the American Lung Association is a great resource for information.
All right, Dr. Martin from the Deborah Heart and Lung Center as well. Thank you so much for joining us. We appreciate it.